Hey everybody, it's Dr. Akiba Green here. We're talking about gluten sensitivity testing and really a review of test options. I know it gets very confusing. Many patients come to me with the gluten or food sensitivity test done elsewhere. Patients have talked to me about a test called the ALCAT test that's commonly run. Also, patients will come in with salivary food tests. Many times they'll show a gluten or dairy sensitivity, but the doctor who ran the test didn't even tell the patient they had a problem. It's often hard to interpret what these lab tests are actually meaning, so this video is designed to help break down the different tests and give you info you need to find out how foods affect your body. So some researchers believe that the body may be too exhausted to even properly process proteins needed to make very many different antibodies. So if a negatively tested patient still suspects a gluten-related reaction, the patient is wise to seriously respect his body's message. There are many different types of tests to look for. One of those tests is this ALCAT test. Now, it's a non-antibody marker. This is important. Some blood tests don't even look for antibodies, and this is really important because when I talk to a patient about gluten sensitivity, I'm talking about an immune reaction against gluten. ALCAT tests actually react the blood with different substances. They're called antigens, call them foods, if you will. In this case, gluten-related antigens, and they look for changes in white blood cells or specific white blood cells called lymphocytes that may indicate an immune response. So the ALCAT tests the white blood cell reactions to various substances. There's a test called an ELISA ACT panel that tests B cells within which the antibodies are made. These changes can be swelling, granulation, apoptosis, or tissue death, or other changes. And these tests really are controversial. I mean, some professionals believe they pick up foods the person eats frequently, not necessarily ones to which they have an immune response. Some patients believe the tests help them identify problem foods. But again, these are not antibody tests. Most labs also look for deaminated gliadin, which is considered more likely to be positive if an immune response is present. That includes those tests. So some labs also test for cross-reactive foods. Other problematic substances, gluten grain substitutes, foods, organs, tissues that are most prone to gluten damage due to their similar protein structure. Cyrix Laboratories is one of these labs. Specifically what we're talking about is the amino acids are so similar that your body doesn't know the difference between that substance that's cross-reactive and gluten itself. Now, these foods include milk, so we're talking about the actual proteins or polypeptides that are in dairy, as well as antibodies, IgA, IgG, IgM, egg, corn, soy, yeast. How about barley, rye, spelt, Polish wheat, durum wheat? These are actual gluten grains or forms of wheat. Buckwheat, sorghum, amaranth, tapioca, potato, rice, and hemp. They're considered gluten-free, but they can cross-react in some people. Even oats are considered gluten-free if they're processed in a gluten-free environment and marked as such, but many folks will react to even gluten-free oats. Sometimes coffee, chocolate, and sesame can also cross-react. Now, it's important to note that quinoa, buckwheat, millet, sorghum, and other non-gluten grains are now suspected of being problematic for some patients. It's helpful to test gluten substitutes. So what we do is we look at, if the gut is still leaky, meaning it allows substances to cross the gut wall before they're sufficiently broken down and create these toxins and inflammation in the body, and the body becomes more reactive to substances, including gluten substitutes. So Cyrix Labs tests for all these markers. It's a great panel for looking at food sensitivities as well as gluten substitutes. Now, there's other tests that are called tissue damage tests and biopsies. Villi-focused celiac specialists, we're talking about the traditional system, use villi and skin biopsies as the gold standards to diagnose an immune reaction to gluten, and only then do they prescribe a gluten-free diet. Gluten sensitivity specialists do not use a villi biopsy for gold standard gluten sensitivity diagnosis, but may utilize an endoscopy if there are other reasons to examine the gut. So the key thing is, if they're already there, we may recommend a biopsy to check, but ignore a negative biopsy diagnostic, since the villi could be healthy and other tissues in other places in the body may be targets of damage instead. To look for tissue damage in other places that are not easily biopsied, gluten sensitive or gluten syndrome specialists rely instead on organ tissue function tests, predictive organ tissue antibody tests, to check for possible organ or tissue damage, coupled with gluten antibody tests. These are where tests like Cyrix Labs come into play. If a patient has gluten antibodies, a gluten-free diet, other treatments are prescribed, the tissue antibodies are rechecked down the road for possible improvement. Some common tissue antibody tests that indicate organ damage, really it's pretty comprehensive. I mean, we've got tests now available that look at brain and nervous system dysfunction, myelin basic protein, cerebellar tissue, neurofilaments, the ability to tell a patient if they're predisposed or developing an autoimmune reaction to lead to multiple sclerosis, Alzheimer's, Parkinson's, or cerebellar ataxia. How about thyroid, TPO and TGB antibodies? Hashimoto's, Graves' disease? How about pancreas, glutamic acid decarboxylase, or GAD65? What about diabetes, or type 1 or type 2, all sorts of different types, right? Stomach, parietal cells, pernicious anemia, B12 functions, heat shock proteins, DPP4, it's a digestive enzyme that breaks down gluten, milk, and soy. We can test for these antibodies and help determine how severe the autoimmune damage is in the body. There's also gene tests. Now, according to most researchers, gene tests are not proof that the immune system presently reacts. They do indicate a predisposition for gluten sensitivity, however. So celiac-focused specialists look at HLA-DQ2, HLA-DQ8 for celiac predisposition. There are other genes in other locations that are under investigation. The most complete gene tests are run in 2 parts. Most celiac-focused specialists, their gene tests that they recommend, don't report the patient's actual genes. They're just looking for a positive or negative on the celiac gene, HLA-DQ2 or 8. If they're positive, some labs provide the specific 2 or 8 gene subtype upon request, but the bottom line issue is, they can be $400 to $500 or much higher if they're gone through a hospital or celiac center. There's a lot of those online that you can order, and it's not going to tell you if you have the gene, it's just going to tell you if that gene is turned on. There is another perspective on genes. Dr. Ken Fine, he runs InteroLab, recognizes that HLA-DQ1, 2, 3, and 8 are gluten-associated genes. He states that DQ4 is the only HLA gene that does not appear to be related to gluten reaction. According to Dr. Fine, this translates to an 83% of the Caucasian population as gluten-sensitive gene carriers. 83% of Americans have the genes for gluten sensitivity. InteroLab reports the actual gene themselves that the patient possesses, not just positive or negative. This is important because you may only have one part that's on, or you may have none that are on, but you may have the carrier, which means that your child may have it as well, or your parents may have it as well, and it's turned on and they're getting affected. InteroLab only runs a 1-part gene test, not the second type. They don't do the allele, the subtype for those DQ2s. The reason for that, really associates with the fact that in their explanation, there's an overwhelming majority of HLA-DQ2 results that favor the celiac allele. So they don't need to run it. Basically, if they find that you have HLA-DQ2, you're going to have the reaction. And it limits the price for patients. Getting that test, it still provides the information necessary to their clients to make an informed decision about whether or not to adopt a gluten-free diet. The gluten syndrome-related gene test, InteroLab test, that gene test is about $160, $169 I think is the current price. So the key thing is you can get that test done, know if you have the genetic predisposition to gluten sensitivity. Even if other tests come back negative and you see an improvement on a gluten-free diet, you know that you're beneficial going gluten-free. Dr. Fine does believe that if gluten is presented to the immune system, meaning that if it slips, properly digested, beyond a mucosal barrier, like the gut wall, the immune system always reacts if a gluten sensitivity gene is present. Dr. Fine's work is highly respected for its clinical accuracy, but to date it does remain unpublished. That's important. InteroLab is well respected as a gene test, but his work is not published in the medical literature. Dr. Vajani, Cyrix Laboratories, who is very well published in the medical literature, does not believe a gene is necessary for immune responses to gluten. If it's present, it does predispose you. He believes that toxins, in particular stress and infections, are sufficient to trigger immune responses without a gluten-related gene. He considers HLA-DQ2 and 8 when he came to this conclusion. He looked at those and said, okay, yes, I'm looking at those markers, and I don't believe they're required. Now, the more markers tested in the more places in the body, in the most mediums, the higher the chance of finding evidence somewhere in the body of an adverse reaction to gluten. There's no guaranteed order of testing priority. Patients who test extensively become convinced that they're not gluten reactive and may develop a gluten reactivity in the future, often triggered by stressors, toxins, or infections. Some researchers say that the genes are not needed but can predispose to adverse reactions. Some patients go gluten-free because they believe gluten is not good for anyone due to changes in the gluten grains and other health issues that we see today, like genetic modification. Without test confirmation, it is more difficult to establish and maintain a lifelong strict gluten-free diet. I tell my patients all the time, you got to go gluten-free based on what I'm seeing, but if you want to be absolutely sure, we run the test, and if it's easier for you to give up wheat for the rest of your life, then we run the test. Some patients won't find confirmation though, because there are still incomplete tests available today, no matter what. I've had several cases, it's not common, but I've had several cases where a patient may have an autoimmune reaction and the gluten panels are negative, but we know there's a link between the two, so they still have to go gluten sensitive. And also, there's those patients who seesaw on and off a gluten-free diet. They ended up triggering painful or atypical reactions in their body, including neurological symptoms. A few patients going gluten-free can trigger a temporary withdrawal reaction, similar to a drug withdrawal, with a variety of symptoms as well. I mean, I've literally seen teenagers on video crying, having a temper tantrum on the floor because they can't have their bread for 4 hours in at least one case. I mean, crazy. Just who would imagine that wheat could cause that big of a professional or a neurological reaction, but it can. Now, some professionals believe the immune system is still too hypersensitive. It's like running in high gear, even on a gluten-free diet. They believe that it needs to be shifted back into neutral to avoid continued overreaction and autoimmune damage. Many doctors believe that this involves other lifestyle changes beyond going gluten-free. I am one of those doctors. Many patients choose to avoid or reduce toxins, sugars, grains, processed fats and foods, even electromagnetic radiation. And they look at more nutrient-dense organic, pastured animal foods, sometimes raw foods, and simplify their lives to avoid stress. Even GMO or genetically modified foods can become an issue with many of these patients. My office specializes in helping identify what is causing the immune system to attack the patient's body. If it's a gluten issue, we're going to find it. If it's another food, we're going to find it. I pride myself in being able to tell patients, absolutely, here's a diet that you can successfully eat for the rest of your life. I then work with patients to help balance their immune system, prevent it from attacking the body in the future. The goal is truly correction and balancing of a patient's immune problems. If you're interested in learning more, I encourage you to call and schedule either an in-office consult or a distance medicine consultation with me to see if we can help with your chronic health problems. My office number is 704-987-3993, and my website is www.drakibagreen.com. Thank you.